due to COVID-19. And WHO feels that this is underestimate. It's a tragic number, and we should learn to do much better. What we are not learning behind all these grim statistics is how many of these 3.5 million people and beyond we have lost to COVID are NCD patients, non-communicable disease patients. Are the most affected and the most at risk for severe COVID-19 disease. That is why it is an honor to be here today in the presence of Dr. HARESHVARDHAN, the Minister for Health and Family Welfare of the Government of India and Chair of the World Health Organization's Executive Board, Dr. Dechen Wangmo, Minister of Health, the Royal Government of Bhutan, and President of the 74th World Health Assembly, and congratulations on your elections, Madam. Dr. Daniel Ngamije, Minister of Health, Government of Rwanda, Dr. Amadou Lamine Samate, Minister of Health, the Government of the Gambia, which indicates the global priority national governments are giving to jointly tackle the twin challenges of COVID-19 and the non-communicable diseases. This is indeed a timely call to action by the Defeat NCD Partnership and partners as the world continues to grapple with the twin challenges of the raging COVID-19 pandemic and the underlying health crisis of non-communicable diseases, a growing problem which leads to over 41 million deaths annually, premature deaths. One way of overcoming some of the constraints and challenges posed is through leveraging artificial intelligence and telemedicine. We at UNITAR are committed to supporting national capacities to achieve the SDGs, particularly SDG 3, enabling universal access to healthcare. The Defeat NCD Partnership hosted by UNITAR is targeted at reducing mortalities due to NCDs by 1/3 by 2030. However, the COVID-19 pandemic has disrupted health services in over 75% of low and middle income countries, making this goal much more difficult to achieve. The Defeat NCD Partnership at UNITAR has initiated capacity building initiatives in Myanmar, Rwanda, Gambia, and we are scaling up support in India, Ecuador, Bhutan, Nepal, and the Caribbean region to develop multi-sectoral action plans to reduce the impact of NCDs on society. We have also launched the Defeat NCD Marketplace to provide quality-assured, fairly priced NCD drugs and diagnostics to lower and middle income countries to overcome the gaps between demand and supply. The presence today of Dr. Bandar Hajar, President, Islamic Development Bank Group, representatives of the Asian Development Bank, is heartening as this indicates global commitment to finance the health infrastructure to meet the growing burden of NCDs and COVID-19. In addition to the participation of the Qatar Ministry of Health, represented by Dr. Mohammed Al Thani, showing Qatar's commitment to support our efforts to make the availability of quality, affordable medicines and supplies a reality for the most vulnerable. It was also great to see my friend Dr. Nabarro, one of the most persuasive and strong champion on health issues that I have met. The health sector has been historically underfunded, and within the health sector, NCDs have had extremely low in priorities. No wonder then that today 71% of global mortality is due to NCDs. The Defeat NCD Partnership is partnering with leading private sector healthcare companies such as Viatris, which I am pleased to welcome today, multilateral banks, the International Finance Cooperation, Multinational Investment Guarantee Agency, and bilaterally with governments to develop innovative products such as social impact bonds to provide universal access to healthcare in LMICs. I hope that this high-powered call to action from some of the world's leading health ministries and multilateral banks will stimulate action in the global community and in national governments to step up screening for non-communicable diseases and continued uninterrupted healthcare to patients in need. Thank you, Juliet.
Thank you, Nikelsa, for that introduction and also for outlining the challenge that lies ahead and the collective work which is happening at every level to make sure that we live in a safer world where health services are equitable for all. Now, I want to move on so that we can have an insight in some of the key research that has led to today's event. And it's at this point that I would like to invite to the floor Praveen Pardeshi. Now, he is the Program Coordinator for Global Scale Up at the Defeat NCD Partnership. So, Praveen, the floor is all yours.
Thank you, Juliet. And as our Assistant Secretary General mentioned, the elephant in the room is really the non-communicable diseases. What we started observing, as you can see from this graph, that when the society is very healthy, even if the COVID infection is high, the COVID case fatalities are very low. A case in point is Singapore, which has amongst the lowest non-communicable disease mortalities, which is 186, which is lower than the global average by more than 50%. And its COVID case fatality rate is less than 1%. But as we move up the line of having more, having higher mortalities due to non-communicable diseases, the curve of COVID case fatality rate keeps going up. So we use this initial observation to do some serious number crunching. We joined with the Economist Intelligence Unit and Beatrice, and what we found is an astonishing result. When we did number crunching across 150 countries, we found that every 10% reduction in the annual non-communicable disease mortality rate, that is, if the society becomes healthier by having less mortality due to non-communicable diseases, the COVID case fatality rate declines by 20%. Now, this was a very interesting observation. If we look at the current COVID case, the non-communicable disease burden, which is on an average 5 per 1,000, it leads to an average of 2.4% COVID case fatality rate. A country of 60 million will, with a 10% rate of infection, could have almost 144,000 deaths. So this is not a very healthy society. If we go further, and if we were to achieve the SDG of reducing by 1/3 the COVID, the non-communicable disease mortalities, so we reduce it by 1/3 from 5 to 3.75 per 1,000, we find that the decrease in mortalities due to COVID comes down from 144,000 to 108,000. And if we were to halve this rate, which is possible because countries like Singapore have already shown this, we find that the COVID case fatality rates will go down to 1.4 per 100, or just about 84,000. So simply looking at this data, it has huge implications for our programming, that to control COVID, we need to actually reduce the underlying disease burden due to non-communicable diseases. Now, this has an implication for our global programming. The World Economic Forum calculated that we need $371 billion per year to reach the universal access to health. But if we, this would take up to 2030 to reach if we spend $371 billion. But the world has committed already $10 trillion for achieving the for responding to COVID, which means that we had already spent 2.8 times more than what was needed. So this meant that if some of the resources of COVID could be re-engineered and could be applied in a synchronized manner, for example, the COVID vaccination track and trace services could be used to also detect for non-communicable diseases, then we could take on the challenge, the twin challenge of COVID and NCDs in a synergized manner. And that is exactly what the Defeat NCD is seeking to do in its program countries, where we say that the two battles are to be joined together, and basically COVID is just an X-ray revealing the underlying non-communicable disease burden. Thank you.
Thank you very much for that presentation, Praveen Pardeshi, which really was excellent and very powerful. And can I alert our audience to the fact that we're going to look at that research a little bit later on in the session with the other partners who are involved in this, the HARESH and the Economist Intelligence Unit. But Praveen said that there are implications arising from that research, and we're going to look at those in a little bit more detail with our speaker, Dr. David Nabarro. So, Dr. Nabarro, thank you so much for joining us. Now, let me tell you a little bit about him. He is the co-director of the Institute of Global Health Innovation at Imperial College London, and also strategic director of 4SD, and of course special envoy of the WHO Director General on COVID-19. So we appreciate the fact that you have taken the time to be with us. Now, Dr. Nabarro, you have been at the forefront of global efforts to control the pandemic. And in this time, we have seen the world coming together to contain the pandemic and at the same time develop various treatments, notably the vaccine rollout program. But you and I are both aware that there are disparities, the fact that 85% of vaccinated people are in 12 countries. So that is pretty one-sided. So what are the main lessons and indeed guidance that should be applied to the NCD context, given that we're over a year into this pandemic? So what is it that we can learn from and indeed build on?
Thanks very much indeed. Juliet, it's a meeting that I would not have missed for anything. It's so important. And it's a chance to really acknowledge the presence here of some really important and influential people. I would just like to greet all ministers, colleagues and friends, but particularly I'd like to give a special reach out to the chair of the WHO Executive Board and the chair of the Assembly, who are both here. Really fabulous to see you. And what am I personally seeing with COVID? I'll just tell you three things. One, it's not ended. It's still ferocious and it's got a long way to run. And we need to continue to get ourselves focused on the rest of the marathon. And I believe the worst part is yet to come. Second, the world could do much better on COVID. Somehow, as a world, we've not found it so easy to pull together like we did at the beginning of HIV and like we've done on so many other global issues. I think it's partly because COVID is quite deceitful. Many leaders have ended up thinking that somehow it's just a mild disease, a bit like flu. And that if we're strong, we can fight it off. And if as a nation we're strong, we can win. But I think what we've learned, Juliet, during the past year, is that this apparently mild illness is actually very serious indeed. Long COVID affects about 1 in 20 of those who get the virus. And we haven't started to compute what the impact of this long-term reduction in people's capabilities is going to be. COVID, as you've all pointed out already, is the great revealer, and it's revealing fault lines in society that we'd kind of come to terms with, but now we realize they're just not incompatible with a sustainable future, particularly the extraordinary levels of inequity in our world, and secondly, our failure to work together on governance of dealing with a global health issue. So we could do better. And in a way, we've been deceived by the apparent mildness of the disease. This is not a mild disease. This is a ferocious, unpleasant, and destructive virus. And it needs the global response that WHO is fighting for, and it needs it immediately. Thirdly, COVID is about inequity. Poorer people everywhere get it the worst. Poorer people everywhere find it hardest to access care. Forward people, poorer people everywhere are affected by the containment measures more than anybody else. It's a disease that is actually highlighting the inequities in all societies. Just look at the epidemiology from the United Kingdom. The hotspots right now are in the poorer parts of the country. And that's something that everybody needs to understand. So where do we move from here? Number one, a lot of the extreme illness and death is in people who are suffering at the same time with what are called non-communicable diseases, but what I would like to refer to in particular as chronic disorders of the metabolic system and of the cardiovascular system. In particular, diabetes just carries a much worse prognosis. And so the non-communicable diseases are revealed by COVID, as Parveen just said. And we've got to respond to COVID in a way that takes non-communicable diseases seriously. Number two, people are the solution, because the problem is caused by a virus. So everything we do in government, in civil society, in our professional organizations, in our businesses, must be to empower people so that they can work out for themselves what life living with COVID is going to be like in the foreseeable future. This is not going to be a COVID-0 world for a very long time. So instead, we have to live with the virus in a way that enables us all to hold it at bay. And number three, we won't, as a world, be able to vaccinate ourselves out of this pandemic in a hurry. Everybody who is at risk should be able to be vaccinated. That is key. But the use of vaccines as the primary means to stop the pandemic will mean that certain countries will hyper-vaccinate their populations because they see this as the best containment strategy. But that's not the way to use vaccines. Vaccines prevent death amongst the high-risk population, particularly those with NCDs. We should be prioritizing vaccines for those who are at risk of death. And the process of dealing with the pandemic should be built around basic infection disease procedures, a fully engaged population, a highly effective public health service that can detect people with the disease and isolate them before it's confirmed, and then the necessary contact tracing and quarantining process that stops clusters from developing into spikes from developing into surges, and surges becoming explosive outbreaks. There's only one way to deal with this pandemic, and that's through the full involvement of the people and the widespread pursuit of public health measures. Reliance on vaccination to end the pandemic at this time is most unwise. In conclusion, people with non-communicable diseases are being singled out by COVID, and they are likely to get severely ill and to die. As a world, we can prevent this suffering and death through the proper use of the precious vaccines that have been developed as part of immunologically shielding those most at risk. As a world, we can deal with an issue like COVID through empowered people and widespread, well-developed, properly supported public health services, networked together by a well-equipped World Health Organization. But those public health services need to be led by governments that prioritize public health and that do not continue to see reductions in public health capacity and capacity to deal with major challenges like non-communicable diseases, and with the movement of monies into acute health services. Acute health services cannot provide public health care. In summary, get the public health right, focus on equity, protect those with non-communicable diseases, use vaccines fairly, and then we might be able to come through COVID without long-term major damage to the social, economic, and political fabric of our world. Thank you.
Dr. Nabarro, thank you so much for that very powerful message. And also as well, thank you for dispelling some of the myths surrounding COVID-19, because they are there and it has impacted the way that some people respond to this, indeed the way that some individuals treat it. But